To order the Health and Human Services and Aging Committee, Wednesday, January 16th, 2019. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Jones. Mr. Jones is absent. Ms. Brown. I am present. Mr. Miller.
I am present.
Ms. Stevens. Ms. Stevens is absent. There is a quorum.
All right, thank you. Anyone signed in for public comment?
Yes, Madam Chair, Ms. Liu.
Good afternoon.
Good afternoon.
Well, today we are talking about food and nutrition, all these important things. But we know people in the county jail, people in the homeless shelter, people in whatever those drug treatment centers, group homes, mental health treatment centers, all these people are not getting much, not getting any in some cases. The Farms Bill was signed, but actually even the families raising children, they will encounter cut on their food stamps. So for the seniors, we already know living in some kind of low-income housing, having food stamp card only already for single-digit dollar amount on their food stamp card every month, what will happen to them? Also, what will happen to these people if they are the one actually has to take care of grandchildren, but not actually could really connect all the benefits together in order for him or her to get a sufficient dollar amount for himself and the grandchildren. This will become serious. Federal government shutdown still on. So lots of these people stay in low-income housing, doesn't matter with the voucher or with the rental subsidy, same thing. Very soon, they will face eviction. However, how many homeless shelters do we have in this county now? Please understand, it's a bad situation, but if we don't do anything to break this vicious cycles, our county will not be able to progress. We really need to rethink about all these things. Just like the 230-something people, seniors, still on the wait list for hot meal delivery, for the home care assistance, all those things. Will we be able to help all these people too? At least last time I checked, as Ms. Conwell mentioned clearly, lots of people right now in this county, they're in fixed income. Not just fixed, actually. It's a fixed low income. If we cannot get everybody's situation stabilized to improve their situation, what will we have in this county? Not really much. Don't even worry about having new workforce, new job opportunity to revitalize the whole county. That will be impossible. Please think about that, and we need something really good and fast. Thank you very much.
Thank you. Madam Clerk, anyone else signed in?
No, Madam Chair.
All right. I'd like to make a motion to approve the minutes from the December 5th, 2018 meeting. Is there a second?
Second.
It's moved and seconded twice. All in favor, say aye.
Aye.
Matters referred to the committee. We have one item on the agenda today. Madam Clerk, if you could please read that into the record.
Resolution number 2019-0022, authorizing an amendment to a master contract with various providers for the Supplemental Nutrition Assistance Program to Skills Program for the period 8/6/2018 through 9/30/2018, to extend the time period to 9/30/2019, and for additional funds in a total amount not to exceed $1,771,626.06.
Thank you. And who is presenting today?
Good afternoon, David Merriman, Department of Health and Human Services on behalf of Cuyahoga Job and Family Services. First off, thank you very much for hearing this item today. We are requesting approval of an amendment to a master service agreement that will extend an existing program for an additional year. What I'd like to do is I'd like to briefly introduce the item. Then I have a video that I'd like to show. It's a brief video. It's, I believe, less than 5 minutes long. Does a very nice job describing the context of the program and some of the outputs. And then what I'll do is I'd like to walk through in a little bit more detail what it is that we're requesting today, how the program is going, and where we're going with next steps. I think as needed, or to respond to any questions that are presented, I've asked the managers for the program that we've all worked together to help stand this program up, Shantae McCurdy and Deanna Boswell. So they may be coming up as we get into the presentation. What is in front of you is a request for a master service agreement that will enable us to request reimbursement when a community provider has funded a workforce service that serves a resident that's on SNAP. That community provider has paid for that service entirely. And we are requesting on their behalf federal reimbursement. And the request to the federal government is for us to we ask for 50 cents on every dollar spent for eligible activities. We reimburse to that provider 45 cents on every dollar and then maintain 5 cents for administrative purposes. So this is a program that's we've worked on now for 2 years, probably a little bit more than 2 years. And we are beginning to see the program into implementation. And I believe it has a very bright future. We can talk a little more about that. But what I thought might be beneficial would be for me to just briefly share this video, if I can play it now.
Here we are in a tight labor market where you hear employers saying that they can't get the skills that you need, and at the same time, you have families saying that they can't afford all of their basic expenses. We have to fill that gap, and that's where SNAP ENT comes in.
The colleges do a wonderful job of working with employers and saying, what do you need us to teach? And then teach them and then hook them up with employment.
I managed a phone store for about 4 years. The family I worked for, they ended up selling the business, so my hours were cut dramatically. I had a young child, so I kind of thought, what's the best route for me at this point?
Jamie started with us in the CNA program, and she has just been phenomenal to work with along the way, and it is just so great to see her progression. People that come into our center want to work.
It's not that we don't want to do anything and we want food assistance because we want to sit at home. We just need to be able to feed our families while we're trying to do better for ourselves too.
I talk to employers all the time and say, we need people, where are they at? Well, they're here. We just have to support them and help them get to the point where they need to be at to enter into those open jobs and those positions that are very difficult to fill right now in our economy.
Here at GMT Corporation, we've been in production machining now for 20 years. John Deere and Caterpillar are our two main customers in the production facility. There's a lot of machinists here that are going to be retiring in the next 10 years, 5 years, and it's going to open up a lot of opportunities for guys like Daniel coming in here, learning how to run the machines, and there's also management position.
I've been employed at GMT for 7 months. When I started off on a one-man cell, training with a veteran guy, and then now I'm in a two-man cell with 7 machines.
Manufacturing, IT, healthcare, those are big career pathway areas that we focus within our program and at the college.
There are a ton of opportunities. There's just so many places that need nurses.
The opportunity that we were providing with job training programs that is supported by SNAP ENT funding is an opportunity for people to gain both the professional skills as well as the technical skills, get that job, and then continue to develop in that job.
Having a job at North Shores, it allowed me to provide for myself, provide for others, and just be self-sufficient.
All of our participants, and this year we will have nearly 500 participants, will have had an opportunity to learn in a real operating business. And so that transition into their new role when they are employed by an employer in our community is much easier.
The SNAP ENT program is doing a couple of different things to help out the economy. One is, the immediate resource of people, that human power that businesses are getting. Those people are also not only spending more, but spending more time in their communities. And our businesses can then expand beyond what they currently have too, and hire even more people, which is great for the local economy and great for the state.
As we look across the state of Washington, and there are SNAP ENT programs in every single county in the state of Washington, we have seen this tremendous movement in terms of employment and income earning power.
So why not invest in who we have here and help them help us as a community?
Oops, I'm going to try to kill this before it goes again. All right. So again, thank you very much for hearing this item today. And what we're presenting to you is the implementation of our SNAP 50/50 program. You may recall, I know some of you have served on Board of Control meetings in the past, where we've brought forward requests to work with an organization called Seattle Jobs Initiative, or SJI. 2 years ago, actually 2016, now 3 years ago, we began working with the Seattle Jobs Initiative to replicate the state of Washington's SNAP Education and Training, or SNAP ENT, 50/50 reimbursement program. Over 10 years, the state of Washington built this program where in the first year they served 1,000 people and they drew $1 million in federal reimbursement. To 10 years later, they were serving 30,000 people, drawing $20 million. And we looked at it when given the opportunity through some resources by Senator Williams for us to replicate that program in this community. And we began with doing a needs assessment, doing some due diligence, building up our internal capacity, building up provider capacity. And late last year, or actually say early last year, we released a survey to our community partners to say, who would like to start to explore this with us? This is a different way of doing business. This is not us releasing a contract. We are not giving $1 million contract to these providers. We're saying we expect you to spend the money entirely, and on your behalf, we will request reimbursement and give you a portion of what is reimbursed to us. And in the same way that Seattle and the state of Washington's basic food and education program has changed the way that a partnership is formed as well as it functions, so that this is less about us telling our provider, this is who you serve, this is how you serve them, and these are your reporting expectations. This is much more about residents going to a provider and saying to that provider, I need help. I need help with my workforce. Maybe they're getting our benefits, maybe they're not. Maybe the provider knows that, maybe not. And instead of that resident needing to do our work activities as we assign them, as well as go forward and engage that provider in the way that they would like to be served, we're collapsing that into one relationship. We're saying to the provider, you tell us, and the providers are Newbridge, Cuyahoga Community College, the Puck County Library, the Centers for Families and Children Towards Employment, and Youth Opportunities Unlimited. We're saying to them, tell us who you're serving. Tell us who you are working with on workforce programs and what activities they're doing. And what we do is we look to see, are they currently our clients? If we're currently serving them and they have a work activity, we can count and credit the work activity that provider is doing instead of us needing to fund it ourselves and us needing to make the referral. So we're finding our clients within the caseloads that are being served by these 5 providers, these 6 providers in front of you, crediting those clients the work activities and drawing reimbursement from the federal government on their behalf. And then that money is going back to that center to grow their program, to do more services. So we think this is really a win-win-win. This is a win for the client because the client has went out and they found the provider that's going to meet their needs. They made the choice to go to that provider. And they've engaged that provider, and that provider has started to serve them. That motivation is already there. This is a win for the organization because now they're getting revenue that they've never gotten before. And I should say that the revenue, it has to be local dollars. You can't draw reimbursement on like TANF dollars or Medicaid dollars. It has to be local money that's being spent to help that person. So they're getting new money coming in. And then it helps the community because now we are all working together so that we're not referring that resident to one provider and they're going to another. And we really feel excited about this program because this is going to allow us to serve more people with meaningful activities. Much of what we do with people that are receiving a benefit and have a work requirement, we send them to a volunteer opportunity. They can go somewhere, a church, a child care center, a food pantry, maybe work the front desk, maybe help assembling food bags. Those are good experiences that can help that person create a new network, get some valuable work experience, but it's not really giving them a skill. It's not really giving them a credential. It's not really exposing them to a job that has possibly a direct cashable wage. What we're doing now is through these providers, and I'll use one for example, Newbridge. Newbridge is finding out who they're already serving. They're helping them. They're giving them the supportive services and the case management to get through their training and education program, and then placing them into an organization based on their education. So we got a great report from Newbridge last month. I'm going to let Deanna talk about it briefly, but it, talking about our graduates from our program, they're finishing and they're getting better jobs than they had prior to starting the training, and that's what we want to do with this program. I got to say one last thing, and then I'd like to open it up for questions, and then I will bring Shante McCurdy and Deanna up just to introduce themselves in case you have questions for them as well. But the last thing I'd like to say is, so the organization that helped us create this program, Seattle Jobs Initiative, was funded by the federal government to replicate their program around the country. And in the first wave, Ohio did not choose to do it. Ohio did not ask to have that program replicated. So we did. So Cuyahoga County did. We said, if you're going to try to build that same program in 10 other states, we want to be in the same cutting edge as those other states. And there's some of the best states. Minneapolis, they do some of the best work, and they did the same thing as us. Several others, including other states that have established the work activity for Medicaid. You may be aware that this is an idea that's being discussed. In the same way that people receiving food assistance and cash assistance have to do something to get their benefit, there's discussion about people receiving Medicaid would have to do something to receive their benefit. And what all of the states are starting to look at is this exact model that I'm proposing today is how you get more people in Medicaid meeting their Medicaid work requirement. We don't have that in Ohio yet. That's not the plan. That's not the law at this time, but it's being discussed. And if Medicaid work requirements come, I don't know that we'll have the funding to serve every single person. What we need to know from our community, from the providers that are here in Cuyahoga County, who are you already serving? Where's a client already going to a program? Because that will meet their work requirement. It'll meet their work requirement for food assistance, for cash assistance, or generally for cash assistance. And if Medicaid work requirements do come, it could meet their work requirement for that as well. So this is very, very valuable now to us, but it's also going to be very valuable if in fact there is a policy change and we have to implement Medicaid work requirements as well. So there's a lot there, and the mechanics in front of you is a contract it's a master service agreement. All 6 providers have signed the same contract. We've done that in this way so that if one provider is, experiences a slowdown, we don't have to de-encumber or amend their contract to give the money to another provider. By all of them being on the same contract, whoever is spending the money, whoever is doing a great job with their program, there's funds available for them. And in this way, we want these providers to go and serve as many people as possible and use as much of the funding as possible. Because they're already spending the money, we might as well draw the reimbursement. And so the contract is a master service agreement. It's going to give us an extra year. And we already have some ideas about other providers we want to add to this. We want to bring in other organizations. I think I can say that at this time we won't be able to grow this program until the federal government opens back up. For us to grow the program, we would have to amend our plan with the state of Ohio, and then they'd have to submit it to the federal government, is my understanding. There's no one to submit it to, there's no one to review it and return it to us. So right now, we're set with these providers. Our intent is to grow this and bring in more providers as time goes on. So that was my presentation. I'd love to hear if you have questions. But if I may, can I first introduce Deanna Boswell and
I was
Shante
going
McCurdy?
to ask for both of them to come up.
Sure.
They stopped their work, so they deserve to.
Good afternoon, Council.
Good afternoon. Happy New Year.
Happy New Year to you too. I'm Deanna Boswell. Okay, I'm sorry. I've actually been overseeing the 50/50 reimbursement program, working with the eligibility specialists and SNAP to Skills. They have been assigned as the point of contacts to make sure that they meet with the partners. We actually had an excellent opportunity for them to go out and meet with the partners on their site to see what they actually do, what they can provide, and what the type of services they can provide to the participants. I've seen some generational changes through some of the programs I work with, working with Tri-C Cal Community College, working with them. There's been waiting lists for the CDL classes, trying to make sure, because now they're about to reopen. A lot of individuals, predominantly a male-generated field, but a lot of the women have been interested in that field as well. And when they come, they're excited to learn that, like David was saying earlier, we've been using WEP, which is a volunteer program, but with the CDL classes, STNA, they really can see that they can gain gainful employment from that. They're not just volunteering, they really can gain employment, training, skills they need. When they get done with the training at Tri-C, they're ready to drive a truck. They can, some of them can get, they're homeless or need housing, and they can take care of themselves and provide for themselves and their family as that comes about. So that's been excellent. David also had mentioned with New Bridge. New Bridge had just graduated a class of 15 through the 50/50 program. 7 of those, all 15 graduated, and 7 of those were replaced in jobs at the time they graduated with University Hospital. So that really makes individuals feel that they're making strides and they're not just going to something every day, just doing something that doesn't have meaning. And it gives them opportunity to really learn. Just to give you one example, we had a young lady come in at one time, and her son was so proud of her that he went and got her a laptop and things. He said, "Mom, you have raised us, and now there's an opportunity for you to take classes and learn and get that experience." So that impacts families, and that makes a difference so that they can encourage their family and for future changes and bring that type of economic stability to the city of Cleveland.
Good afternoon, Council. My name is Shante McCurdy from the Office of Health and Human Services. I've also been working along with David and Deanna on this SNAP 50/50 program, helping the providers to just get settled in their programs that they already have, just helping them to what they need to help them provide the resources to the clients to overcome any hurdles or any barriers they may have that was stopping them or delaying them or could possibly delay them in getting the programming and the training that they need for job placement.
Thank you. So Dave, this is kind of a similar program to what we talked about initiating in the county in terms of the women on assistance working within the county. So,
Councilman, that's correct. This is, it directly connects to that. For the group, what we're talking about is how can we place more of these residents that are receiving benefits within our own organization to explore employment. What I like about this opportunity, this actually helps pay for training. And in places like Washington, they actually try to get as many families started with this SNAP ENT program because it covers more services. It doesn't come with as much money up front, but it allows for a much more flexible service. And that will be integrated into that program as well.
I'm glad you mentioned the government shutdown, because I was going to say Department of Agriculture is currently shut down, and how, so this program, you're not going to really implement it until it opens up. I mean, you've talked about it, it's in place, but we haven't technically started on it because the government is shut down right now.
We have started, we began last year.
Okay.
We began last year, and I should go through the mechanics of that. Unfortunately, the federal fiscal year for this program, maybe I know it's for other programs as well, it ends in September and it begins in October. So we started the program later than we would like, and so the first period was for the final 2 months of that federal fiscal year. So August and September of last year, we've already made payments on that time. We're already serving clients and ensuring that we're not sending them to other places for services. We've done other services since September. I have to tell you, we've made no payments because we've been waiting the contract. So that no additional payments for that other period has been made yet. We will make those payments. We have funding for that purpose. But there is a question what we'll do once we kind of get through this month.
So when will we make the September payments?
Well, we've already made the September payments.
Okay.
Yeah, we've made the payments for the fiscal year 18, which ended September 30th. We've just told the providers that once we have to go through our process of getting approved by county council, and the executive, and then once we have the approval on the extension, they'll get their payments. And they understand that these are funds that they already have in their budget and programs that they're already running and paying for. We're just submitting reimbursement on their behalf for the 50%. So they understand that.
Okay. So when will we won't be able to get the reimbursement until the government, federal government.
But we'll be able to pay them once you are approved, yes.
Okay, because we already paid them, correct?
Yes.
Okay, so it's just all about basically an idea how we both get reimbursed.
Exactly.
At least 50%.
And the nice thing is, as I described, that we're going to hold back 5% of the reimbursement for our own administrative costs. We can actually, as that money comes in, right now that there's not much of it, but if this program grows the way that we would like, you can actually reinvest that into the program and then draw reimbursement on that as well. So this becomes more of a self-sustaining effort because most sources of federal funds cannot be used to match, but things like the Human Service Levy, like local donations, local grants, United Way, all of those funds become matchable for this purpose, which is really exciting.
So in terms of how were the agencies selected?
So we released a survey. We sent the survey to all of our known partners. We did not do an RFP, and so part of this is an alternative procurement because unlike other contracts, we're not offering to pay the provider anything. We're offering to request reimbursement if approved on their behalf. If anything, there's an element this is revenue generating because we are keeping a portion of the money they spend and the reimbursement. So we completed the survey. This was a survey designed by our technical assistant partner, Seattle Jobs Initiative, for us. And the first 6 agencies, there were a few more that initially wanted to work with us, but this is more complicated than your standard program. And so we selected these 6 as being the most feasible and having significant local dollars as well as clients. It wasn't until we began to actually look at the clients that we saw how many clients they would actually be serving. But it was through a survey that we selected them.
Okay, and who is we?
So this was done through a gentleman that was with us until about June, a gentleman by the name of Eugene Walton. Eugene was managing this program for me, and he was recruited by Richmond, Virginia, to essentially be in the same position that I'm in. And so he left us in the summer, sort of right as we were preparing to implement. Gene managed the selection, he managed the process, he was working with Seattle Jobs Initiative, but we all looked at the providers, we vetted them, and then we all agreed that these providers were in a position to carry out the program.
Okay, so, great, but what first comes to my mind is, I'm all about equity. And so you stated this is something that's benefiting not only us, but these organizations that are getting reimbursed. So you stated that there was a few that, since it's a difficult program, you're not going to let them participate. So I think, I need to understand that fully of why it's so difficult, because you're not only, it might be difficult on our end in some respect, but then we're also stopping these organizations from getting reimbursement themselves.
Sure. So, I should also recognize this is There's one other organization in this community that is funded by the state to do this same sort of work, but outside of that organization, this is the first time this was done here. We thought in working with both Seattle Jobs Initiative as well as directly with a federal staff person that was assigned to work with us and build this program, if we start small, we start with a group that has really vetted workforce programs that have some clear client population that are most likely receiving SNAP, and have the infrastructure to submit the billables to us. They've got to carry the costs. This is not like a TANF contract where they submit a bill to us expecting to get paid within 30 days. They have to be willing to float this for a time. And so they also have to have non-federal dollars. And that's a key. The point Shantae's making about it being non-federal dollars, most workforce programs are funded off of federal sources. Most of the money they get is either TANF, or it's another form of SNAP, or it's WIOA, the Workforce Development Board. None of those funds are eligible for reimbursement. So the programs that we started with for this are organizations that have either gone out and gotten United Way money, they've got Cleveland Foundation money, they've gotten donations, and they've created a program not on federal dollars. There are not many programs that do that now.
So these organizations that you have listed, where does the SNAP tie in? Does that mean that a participant or resident goes to that organization and is on SNAP already, or something to do with the assistance of them getting that?
Yeah. I'll let Deanna answer
that
the
person
question.
on the SNAP benefit.
So the basic way it works is for the rush referrals, an individual can walk in there and they can say that they want to participate in a program. Currently, the process that we're following is the provider sends us a list and we verify whether they're receiving SNAP or not. If they're not receiving the SNAP benefit, then we try to determine their eligibility as quickly as possible to get them through the process.
Now, because all these organizations offer different programs. So which programs are the participants? If my daughter's walking into Newbridge and she says, I want to participate in these programs, I need to understand what are the programs that you're talking about? Because they have to be different programs because all these organizations do various different things. So I just need to understand what those programs are.
Right. You mean like Newbridge?
Because they're going in, what you're explaining is they're going in to participate in something, and because that they are SNAP eligible, that's where this reimbursement part comes in.
Well, they're receiving SNAP.
They're already receiving
They're already
SNAP.
receiving SNAP, or we try to enroll them to start receiving
Okay.
SNAP to begin to draw the reimbursement.
So I wanted to get to that if we were enrolling. Go ahead.
Right, and so from the direct referral process, we have individuals that come right through, either they apply through the 1-8 the online 1-800 number, anything like that. So then once they are determined eligible for food assistance, we have a department that assesses and assigns participants to see so we assess them to see what they want to participate in. So say, for example, someone comes in, they say they want to go to CDL, they want to be a STNA. So we review them and assess them to see what their interests are. Some people may know and some people may not know. But once the eligibility specialist meets with them and determines what they're eligible for, then we know what programs to place them in.
Okay, so you're helping the individual that could be enrolling in SNAP benefits and also those that are already enrolled?
Yes.
Correct.
Okay, toward some sort of workforce program that will, or training that will better their lives.
Let me ask, how about we give a few examples from each of the providers and what trainings they're offering?
Okay, so for Newbridge, they do STNA and phlebotomy technician training. Kyle Community College, they offer 4 programs: the Certified Production Technician, CDL, Patient Access Services, and STNA. We have Cuyahoga County Public Library offering most GED English as a second language. That's their primary focus. 1, 2, 3.
Because I think I had a question about that before, when we when Cuyahoga County Public Libraries got into this. What about the Cleveland Public Libraries?
So Cleveland Public Library is a specific partner of the county library.
Okay.
The county library has the state grant to run the Aspire program. It used to be called the GED program. I'm drawing a blank on what it used to be called. So every Cleveland Public Library is given an opportunity to set up an Aspire GED program. I should say GED is like the SAT. There are more high school equivalency testing programs than just GED, but GED is the best known.
Have they participated?
They are. They are sending us referrals as well. So if a person walks into a library and they start a high school equivalency program, whether it's GED or HiSET or one or the other one, that library will be referring to us. These are the clients that we're serving, and we're going to look to see are any of them receiving SNAP, and then tell us what their costs are associated with providing that service, so we can request reimbursement.
Okay, because the literacy rate in Cuyahoga County is 96%, and in the city of Cleveland, 66. So I always have to push for, sorry, y'all, my city of Cleveland. And I think both of them both of my colleagues got some city of Cleveland in their
It's a
district,
partnership.
so-
Siri Feldman has been very clear. Anytime we're talking to her about the Aspire program, we're including Felton Thomas and his team on this as well.
Okay. And
So then the other two that are on here, so Towards Employment has a relationship with University Hospital, but I think most of their education is done through Newbridge or through Tri-C. But then they do case management, soft skills development. Oh, and that's right. And they have the culinary program, the Bloom Bakery, where people can go and get employed there, or they can start to learn culinary arts. And then the last one, YOU doesn't do as much of the training themselves. They do more case management, and then they refer to they refer to Newbridge, or they refer to Tri-C. And so they're more of the case management provider and less of the direct training
they're
provider.
dealing with the certain age group, right?
They do.
They're
They only
referring-
serve people up to 26
Okay.
or 28.
And and I apologize, I missed what you said about the Centers for Families and Children. What are they doing?
So they have a CVS program. So they have a CVS, as in the pharmacy.
Oh.
So they have a pharmacy
I
program.
thought you said that, and I was like,
Yeah. So they actually, one of their sites actually has a pharmacy in it. So you can, like a mock pharmacy, you can learn how to stock, you can learn how to work within a pharmacy, or a CVS doing either customer service or actually pharmacy tech work. And so those are the main two areas that they have been working in.
Okay. All right. How long have you been working on this initiative to get started? Because you talk about you had conversations with Senator Williams.
So we actually, I think I began in, I want to say 2015 with doing the research and analysis. 2016 is when we actually signed our first contract with Seattle Jobs Initiative, the state of Ohio, and the federal government to start to replicate and design the model. We actually had some slowdowns as we had to implement some more work activities programs. I have to admit there are times that we have to focus more on compliance than on this service. But I think those two things are now coming together in this program. We can be compliant with work activities, but also actually help a person with a meaningful service. And so our service actually began in August of last year when providers were finally referring or sending us the lists, as Deanna described, to say, here's everybody in our programs, how many of them are on SNAP. That really began August of last year.
Okay. And that was 2018. Okay. Just wanted to ask a question off the topic. Do you know if the TANF dollars are going to be impacted by the shutdown in any way?
Councilman, I can't answer that question at this time. I'd gladly check in with Kevin Gowan, the new JFS administrator. I'll have an answer for you this week on that.
Okay.
If we know.
Okay. And what is the total TANF dollar amount that we get?
Councilman,
And just because Senator Williams, Sherry Brown's office asked me.
We can find out.
And I was like,
We'll ask. Again, I'll follow up with Kevin Gowan, and I'll get that information from him and send it on.
because if we're impacted by TANF dollars, that's going to really hurt us.
And any sort of cut at this time is going to be difficult.
Okay. All right, open up questions for Miller. What'd you say?
Madam Chair, Director, the $1,771,626, is that our estimate of how much we're going to get in terms of this federal reimbursement less the 5%? Is that what this money represents?
Yes. Once they submitted, I worked with them through the process of them creating a budget for the program based on how much capacity they have to spend their own non-federal dollars towards these efforts. And in doing that, they individually came up with the amount of the capacity that their budgets can handle. And they submitted those budgets to myself, and I reviewed them. And that's how we determined how much this contract would be and how much we would be asking in federal reimbursement.
And since this was supposed to start on 10/1/2018, why are we not getting this until now?
So there have been some slowdowns. Unfortunately, the process requires that we submit a new plan at the start of the fiscal year. So before we could begin, we needed the federal government's approval of our plan, actually the state and federal government's approval. So there was a delay. We wrote the providers into our plan went to the state then sent it to the feds send it back to the state sends it back to us. So unfortunately, there was a delay in that process. The transition of leadership also caused us to slow down. As you can see, there's 3 of us presenting, and I think the 3 of us have worked together to implement the program. But yeah, I think in the future, there's new leadership at Job and Family Service. There'll be one single point of contact, and we should be able to address any slowdowns or transitions. The last thing is, when finally we had much of the materials in and back to us, we were approaching November, December. I think that's at the time we submitted it, but I do think there were less hearings, less meetings for us to bring the item forward. So we've not made any payments on this contract since the new contract period. We do recognize that the period has begun, and I think, again, as I stated before, we are not paying the providers. They are spending their money, and we're requesting reimbursement on it. So we're not treating this in the same way we've treated other contracts, in that we expect providers to simply float county costs. These are their own dollars. They're going to spend them either way. It's only a question of whether or not we can draw reimbursement on their behalf.
And how is the administrative fee determined? It seems like if we're getting a 50% reimbursement and we give the providers 45%, we're actually charging them 10% of the reimbursement, which sounds like a lot.
It's a fair question. So what we did is we looked at what other communities were doing. There were some communities that did no administrative costs. There were some communities, I think, that did close to 20%. Many did 5 to 7. And we thought, generally speaking, a 10% administrative cost is a reasonable amount. We expect this program to grow. We expect there to be much more administrative burden. And we feel that as time goes on, we need to try to manage the growth of programs with some new revenue that's being made available to us.
This program is not going to work if people can't get on SNAP. Is that correct?
That's one of many impacts if people can't get on SNAP.
I had a meeting this morning with the food bank, and they brought to my attention that currently only 25 to 30% of the people that they're assisting with SNAP applications are getting approved within the 30-day standard time frame, and of the rest, about half of them are disapproved and half of them are stuck in limbo, and the ones that are being disapproved, about half of those are being disapproved because their information regarding their interview is being sent to a prior address, not their current address, despite the fact that their current address is listed on their application. And most of the rest of them are being disapproved because the wait time on the call centers to do the eligibility interview is inordinately long. And My question is, to what extent are you aware about these problems, and what are we able to do about them, and what are we doing about them?
Councilman, thank you very much for bringing the item forward. We're very well aware of them. We met with the Cleveland Food Bank, one of their board members, most of their administrative team, I want to say last Thursday or Friday. We meet with them about every 2 weeks to talk about this issue. We've at least met with them monthly since November, may have been October. So I think I can say we're very well aware of the problem. And what I think I can say, this is their perspective on the nature of the problem. Some of the information they've shared with us, we're very concerned about. I think anytime we hear that a person has called our system and not gotten a quality service, that's something we want to take action on. Some of the things they've shared, I don't know that I agree with. And I don't think it would be appropriate for me to share JFS's response. Unfortunately, Kevin Gowan couldn't make it today, the new administrator. So I'd be happy to bring that item back. I can share with the Administrator Gowan that you had these questions and that you'd like to know more about it. And I can ask him to respond to you directly.
Madam Chair, to the Director, am I correct that the existence of the problem is not in dispute? In other words, that they provided good statistics showing that only 25 to 30% of the applications are being approved in a timely fashion.
Again, Councilman, that's the response to that really should come from Kevin Gowan, the administrator. There were elements, there were data points, there were figures that they shared that I had questions about. I know that we looked at some cases. They gave us a number of cases on a specific day, and they asked us to follow up for family members. I'll admit that of the 4, one was 2 of them. It appears like the family should have had benefits, and we had to act quickly, and we did. But I could say of the other 2, one was a person that had employment. And when we followed up with that permit, that application, they said, please remove my application. I'm employed now. So I don't think that was accurate. And another person, we sent the application to the location, the address on file. And they said, no, I'd rather have it send it here. Well, unfortunately, that wasn't what was in the file. So I don't have the figures in front of me. I've seen them. I think we all agree that we have an opportunity to better serve clients. We have an opportunity to better address food insecurity with residents. There are ways that we can improve. We agree on that. There's absolute ways that we can improve, but I can't say that I agree with all of the figures they've shared with you.
Well, I want to make it clear that from my understanding, a very good part of this problem is at the state end. You know, so I'm not trying to load up on county JFS. You know, I think a large part of it is at the state end, but you know, I don't want to spend a whole lot of time with the various parties disputing over who's at fault. You know, I think it's pretty clear that a serious problem exists, and that you know, we can't have 70% of the people who are eligible not being able to get SNAP benefits in a timely fashion. It's not acceptable.
So I think we all agree that there's a tremendous challenge and opportunity here, which is how do we help more people quickly and efficiently determine eligibility, and when eligible, get their benefit. We gladly work with the state of Ohio on that. We gladly work with the food bank. I think for us to truly tackle food insecurity, we all have to work together. You know, there's opportunities where we could say, you know, we didn't hit the mark there. Maybe there's sometimes we need the community to tell us, okay, you didn't do a great job here, so we can learn from that. But then there are other times where, well, unfortunately, we have to make difficult decisions. I think the key part of it is communication, and that's why we're meeting regularly with the food bank. We're talking to the state, and I think at the end of the day, we all have to look forward and say, how do we keep improving? And I think on that, we all agree that it's going to take that collaboration, that communication for us to more effectively address the problem.
Thanks, Madam Chair.
You're welcome. Anything, Councilwoman? All right. So you'll give me that answer about the TANF
I will.
being impacted and,
Madam Chair.
yes, Councilman.
This legislation is already behind schedule, so I'm going to move approval with recommendation for second reading suspension.
Oh, yeah, definitely was going to do that. In
Thank you.
terms of the federal government, according to U.S. Senator Sherrod Brown's office, the Department of Agriculture will increase the SNAP benefits in the February check. We don't know how much. I guess that'll be based on numbers in the family, and then nothing after, and that is only during the shutdown. So we've got to figure out a way to get that information out to residents. I don't know what we're going to do.
Yeah, we're beginning to communicate, and I think I can share any communications we have on it. We will pass them on to you, Councilman.
Okay. So we had a motion to move this to the full body for second reading suspension. Is there a second? Moved and seconded. All in favor say aye. Aye.
Thank you.
You're welcome. Thank you all for coming down. I gave you guys a report, and I get monthly reports on various things, the numbers of the children that we have, number of homeless individuals that we have currently. So I just wanted to start passing that stuff out to you guys. New year, trying to add new things for me to get together. So that's what you have before you, the actual current number of homeless individuals that we have here in Cuyahoga County at the moment, that are in our shelters, I should say, specifically our shelters. So if there's no other miscellaneous business, this meeting is adjourned.